Hello, welcome back to another graduate department event that we have for you guys today. Today, we will be talking about our dietetics and nutrition graduate programs. I am Will. I am the admissions counselor for our graduate programs here at Fontbonne University. And also, I have with me,
Oh,
hello?
is this where I introduce myself?
Yes, sorry.
Sorry, I thought you were going to introduce me. um, can I go ahead and pull up my presentation? Is that okay?
Yeah, if you could tell them what your name and the
Sure.
department that you're in.
Yep. So my name is Dina French, and I am in the Department of Family and Consumer Sciences. I'm going to be talking today about two programs that are interrelated, yet separate, kind of, which I'll explain all the little intricacies as we go along, hopefully, and of course, I'll answer any questions at the end. Is it okay to get started, Will, or did you have anything else to say here?
Oh, no, I'm fine. I can kind of add my piece on at the end there.
Okay, perfect. Well, then I will go ahead and kind of dive right in. So, like I said, I'm in the Family and Consumer Sciences Department, and our Master of Arts is in Health Advancement and Promotion. We do offer that as a standalone master's degree, and we also offer that in conjunction with our coordinated program in nutrition and dietetics. So, I'll explain a little bit more of that as we go along. So, first, just a few questions. If you're watching this, probably you can answer yes to at least one of these. If you're interested in promoting health and wellness, if you hope to have an positive influence on the health of individuals, families, and or communities, if you have a passion for food and nutrition, and if it's your goal to become a registered dietitian nutritionist, credentialed, then one of our programs might be the right fit for you. So first, I'm going to talk about our standalone Master of Arts program. So I think it's a little easier to kind of talk about that first because that gets interwoven into the dietetics piece. Um, so with the standalone masters, there's the only eligibility really is that you have to have completed at least a bachelor's degree in any field. It doesn't really make a difference. This degree can be a complement. I can't really think of many undergraduate programs, careers that it wouldn't be a compliment to if your career or degree allows you to kind of have that influence on individuals' health. Um, like all of our graduate programs, you need to have a 3.0 GPA and all your coursework completed. But other than that, there's really no specific prerequisites or anything that you need to get into our master's program. Um, and like I said, the knowledge and skills, they're very broad as far as the spectrum of health, which is why they're applicable and really kind of desirable in a lot of different career settings. Just a few examples, and this is really only just a few: education or special education. So if you're maybe working in K through 12, you know, health educators, um, working in that setting with students in the special education realm as well. It's super applicable there. Um, we've had people in the realm of social work complete our master's degree and find it a good complement. And really anything in the medical field, allied health, that whole spectrum that doesn't have a specific credential associated with it could be a good benefit for this. Sports and athletics is another one. We've had a lot of athletic trainers go through our program, so it tends to be a great complement to what those folks do. It's a 30-hour curriculum for this standalone MA and very easily can be completed in 2 years taking a part-time load. That includes taking a summer class, which is helpful to kind of lighten your load during the fall and spring. And all of the courses in our master's program are held in the evening or online so that they can be easily completed by individuals who are working a regular job full time. We leave it really open as well on this pathway. So there's 9 credit hours that are totally open. You get to choose how you want to use those to best support your interests and your career goals. And I'll show those a little bit more on another slide. But we can work with you as an advisor and kind of help you identify what would make the most sense. But we have some additional coursework in FCS, which is Family Consumer Sciences. You can do an independent study and really just craft that however you want, whatever you want to learn more in. We have a practicum where you can go out into the field and get some experience in a setting that you hope to get into, and even make some connections for your next career change with this degree. Some graduate students really want to do a research project, so we set you up really well for that with some of our core coursework. There's a research project series you can go through and basically create something similar to a thesis. And then there's a lot of marketing and management business courses that you can take if you're planning on working in a nonprofit or starting your own business. Those can be great for students looking for that in their career. So this is the core graduate coursework, and this will be the exact same thing when I start talking about the dietetics piece. These same core graduate courses, this 21 hours, is taken by everybody who receives our Master of Arts. So it's courses in advocacy, it's leadership development. You learn how to use health behavior theories, these theoretical frameworks to enhance the population or individuals that you're working with. Applications for health communication is basically learning how to use all of the different social media platforms out there for spreading your health message. And then our interpreting and translating science course helps students to break down complex research and be able to actually explain it to people, to help them understand how their health is influenced by a variety of different things. And then, of course, a graduate program wouldn't be complete, at least to me, without research methods and statistics. So we have graduate level courses in those as well. And then the electives that I briefly mentioned, this 9 credit hour block is totally open and can be arranged however you want to do it. You can mix and match. You could take an FCS course and a couple of graduate courses in business and marketing. You could do the research course series, and you could add in those practicums and independent studies if the other courses don't quite meet your needs. We can craft them so that they do. So that's kind of all I was going to say about our standalone master's program. And I'm just going to go into kind of talking about how that all goes into the dietetics piece. So the coordinated program in nutrition and dietetics is a Bachelor of Science plus a Master of Arts. Same Master of Arts that I just discussed, that same core coursework, woven in with a Bachelor of Science in nutrition and dietetics, as well as a dietetic internship. Just a few quick facts about the program. We are an Ascend accredited program. Ascend is the accrediting body for all dietetics programs that lead to RDN eligibility. When our students complete the program, when they graduate successfully, they are eligible to sit for the credentialing exam for registered dietitians. There's no other steps, everything's included. And just as a side note, starting in 2024, the dietetics profession is going to graduate level entry to follow along with a lot of other health professions. So everybody will need a master's degree starting in 2024. So we're ahead of the curve with that. Also, a really cool thing about our program is it is an accelerated pathway to earn a bachelor's and master's degree. It's one of the first accelerated master's programs that Fontbonne offers. So we're very excited to be paving the way there with this program. It does include supervised practice, which is also called the dietetic internship. That's 1,000 hours working in the field, learning the job of a registered dietitian in different settings. So the Master of Arts, again, is not a dietetics degree. It is meant to be a complement to that base nutrition and dietetics knowledge. So it allows our students to kind of think out of the box in a more broad spectrum of health, rather than just doing graduate level courses in nutrition and getting a master's in nutrition. It allows them to have a different skill set that looks unique and makes them stand out to employers when they're out there applying for jobs. And because we're an accredited program, we have to have a cap on enrollment. So our cap, our enrollment maximum is 15 students per cohort. So we can accept 15 students into the CP per year. Okay, so our coordinated program coursework. Undergraduate is what you're going to learn about, of course, food and nutrition science. But you also learn biological, chemical, and behavioral science. So lots of chemistry, lots of biology, and psychology. You also learn counseling and education strategies so that you can help your clients and your patients make healthier choices and understand their health in a more effective way. And medical nutrition therapy gets into the clinical side of things, working with patients who are suffering from diseases that affect their nutrition. And then my favorite are the food courses because we're all foodies in dietetics. Experimental foods, one of my favorites. And of course, our cultural competence through food classes, amazing. It helps our students really understand the different food practices of various cultures and get to try some of those wonderful foods too, which is why I like it so much. um, and then the graduate piece, that same core 21 hours of the Master of Arts coursework that I already mentioned a few slides back, plus a few other things. In dietetics, you take an elective in either ethics or cultural competence. And there's also some courses specifically for these dietetic students, coordinated students. We have preparation courses for when you're leading up to your internship, prep for supervised practice. We also have an advanced MNT course. And of course, supervised practice is the internship where you do that 1,000 hours. And then a final professional seminar in nutrition and dietetics to round everything out and finish everything off. So once accepted to the coordinated program, like I mentioned earlier, students can start taking graduate courses along with their undergraduate coursework. So that starts at the junior level. So those junior level courses, along with master's courses, senior level courses, along with master's level courses, and that allows them to finish sooner. So that's why it's accelerated. I'll explain that a little more on this slide. So there's really two pathways for the coordinated program. The main pathway is that Bachelor of Science plus the MA coordinated program. This is where students come through as either starting as a freshman, transfer, or a second degree student, meaning a degree in something besides dietetics. And then you internally apply to become part of the coordinated program after you finish the prereq coursework, which is 48 credit hours. Essentially the introductory nutrition classes, chemistry and biology courses, and math, and a couple other things. So once you're accepted to the coordinated program, you have your spot. As long as you keep your GPA where it is, where it needs to be, you can remain in the coordinated program. And those first 12 graduate course credits actually double count towards both degrees. So that's basically 4 graduate level courses. It's late in the week. Math is not working. So 4 graduate level courses, 12 credit hours total, count towards both degrees. So that's why it's accelerated. And as an added bonus, those 12 credits are charged at the undergraduate rate, which is a little bit lower. So that is a good thing too. So this pathway typically takes about 2.5 to 4.5 academic years, depending on whether you start as a freshman or if you come in with some college credit or a previous degree. That is about your timeline, which is still pretty quick to earn a bachelor's and a master's degree, especially if you look at it from starting as a freshman. 4.5 academic years is pretty fast. Okay, so that's the pathway most of our students will go through. And I'll briefly kind of talk about this other alternate pathway, the graduate only pathway for coordinated students. This pathway is only available if we have space. So I mentioned earlier, we have 15 slots open per cohort. We expect to have probably about anywhere from 1 to 5 spots available every year for this pathway, which is for students coming in who already have a bachelor's degree. You must earn a bachelor's degree plus a DPD verification statement from an Ascend accredited school. Okay, so it can't just be a bachelor's degree in nutrition, because there are those out there. It has to be from an Ascend accredited program, and you have to have DPD verification. That allows us to know that you already have all the base knowledge in dietetics, so you don't have to take the prerequisite courses, and you can just come in and do the graduate piece and the internship and get your verification to become a credentialed dietitian. So all that the students on this pathway have to complete is graduate level courses, plus, of course, the internship courses that I mentioned earlier. So all those same graduate requirements, which turns out to be 35 credit hours. And it takes about 18 months to complete. That does include summers. Okay. Both pathways result in the same thing. In the end, once you've successfully completed all the degree and internship requirements, you'll earn a CP verification statement and you can sit for the credentialing exam for dietitians. Just to kind of touch a little bit on careers in dietetics, what's really exciting about this field is there's so many different directions you can go with it, and it's growing all the time because dietitians are becoming even more valued, especially with the current health issues of the world. We can play a huge role in that. So most dietitians, over 50%, are employed as clinical dietitians. Just kind of listed a few places that specifically some of our graduates work. So working in a healthcare environment, working with people who already are suffering from nutrition-related diseases, or possibly working in outpatient and helping them after they leave the hospital. Joyce, did you have a question? I see you raised your hand. Did you want to unmute yourself? Or I can answer it in the end too. That's okay. All right, I'll keep talking.
Okay.
Feel free. Oh, go ahead.
There she goes.
I understand with this program, although I have a master's degree, if the undergrad didn't include coursework that was geared toward nutrition, then I would actually have to start over with a bachelor's.
Correct. Yes. So you'd be considered a second degree student. So under this, oops, let me go back. Under this first pathway here, and if you already have a degree, it would be a shorter time to finish because you wouldn't have to do any undergraduate gen eds. So we would basically evaluate your coursework, and you would take any remaining courses for the undergrad degree and also complete the graduate coursework.
Okay, thank you.
Sure. Thanks for your question. So just to kind of get back through some of these different careers, like I mentioned, clinical dietitians are the most common, but there's lots of other places you can work as a dietitian. Community and public health realm is really big too. Just for example, extension services through a lot of different universities employ dietitians to do nutrition education out in the community. WIC is also an important place that dietitians can make a huge difference, working with state or federally funded programs in nutrition. Management is another realm. You can work as a food service director or manager at a hospital, long-term care, K through 12, helping with writing menus for the National School Lunch and Breakfast programs, those types of things. I've grouped a lot of these together, but they could be discussed separately for sure. But just to kind of give you an idea, corporate wellness is another big area. Working for large companies, providing services for their employees, and private practice and sports dietetics is a whole other area too, where you can specialize. And then research and education. Working at either a university, in a university setting as a professor or a researcher, or possibly a researcher at a medical center is another direction that you can go as well. And we've had a pretty good rate of our graduates getting employed in the dietetics field. So that just based on our graduates from last year, and remember, this is even with COVID in play, 86% of them are now employed working as dietitians in the field. That's pretty exciting for us. And I believe that's pretty much all I had to say. I just kind of included our our web addresses, which are probably easier to just send an email if you can't find these on the website. But we have a separate page for the Master of Arts alone, and then one for the coordinated program in dietetics as well. And of course, you can always reach out to me in email, or you can reach out to Will and he can find me. And are there any other questions that I can answer today?
Okay. Will I receive a copy of the PowerPoints, or at least that last page? So I will have the links to follow up with any questions.
Sure. Can we get that to her easily, Will?
Yeah, so I will, I'll leave my email in the chat here. And also, if you want to put your, Joyce, if you want to put your email in the chat, and then that way I can actually send you that PowerPoint.
Yeah. And I'll send it to you, Will, as soon as we're done
Yeah.
here, so I don't forget. Are there other questions I can answer for you, Joyce?
Would it be, it probably would, I'm not sure, would it be you or Will that would evaluate the classes that I've already taken?
Probably would end up being me.
Okay. Because I did complete the master's there at Fontbonne, and my undergrad is from Webster.
Cool. What did you do your undergrad in?
I did my undergrad in management.
Okay. Yeah, if you want to get in touch with Will, or even if you want to send me an email, if you have unofficial transcripts, I'm always happy to look over those. It's just kind of a, if you just want to get a gauge on what your timeline would be, I could just do a quick look over them and let you know.
Okay, that'll be great. I do have copies of them, so I'll scan them.
Cool.
And send those over.
Perfect.
My undergrad is like a mishmash of, I worked through both of my degrees full time.
Yeah.
So I started the undergrad and stopped and started again. And then the master's, I just did the 2-year program through Fontbonne.
Cool.
Awesome.
Yeah, I would be happy to look over those for you.
Okay, sounds wonderful. Thank you so much for your time.
Sure. No problem. So I have three.
Will?
Yeah, so I have 3 FAQs that I'll ask, and most of these you've already answered, but just in case people are coming back and watching a little bit later. So on average, what would you say is the, I guess, typical, and you already answered this, but how long would it take somebody to finish each one of those programs?
Yeah, I mean, the standalone masters can definitely be done in 2 years pretty easily, especially if you take a class over the summer. And then the coordinated program, yeah, I did kind of mention earlier, it really depends on what kind of coursework you're bringing in. So if you're a brand new freshman, we have it all laid out to take 4.5 academic years. But if you're a transfer, if you have some college credit, second degree, then we'd have to evaluate. But probably the shortest timeline would be about 2.5 academic years. And that would be the best possible scenario where you've taken all the science classes, taken psychology, taken all those courses that kind of fit in.
Right. Okay. That makes sense. And that's pretty typical for most master's programs. It's going to take anywhere from 2 to 3 years, usually, depending on how quickly you're able to finish that. So
cool.
Awesome. My second question is there any special grant or funding available for students?
Well, I think that would depend. So if we're looking at the graduate level, like just the plain graduate program, I know that financial aid looks a little different. I think it's mostly loans. But undergraduate students, I know, are eligible for a lot more financial aid. So if you're coming in to do the BS plus MA coordinated program, there's probably a lot more available. But as a dietetics student, you can also become a student member of the Academy of Nutrition and Dietetics, and they offer several awards every year, scholarship awards for student members. We've had several students get them, so it can be anywhere from I think about $1,000 up to $5,000. So they're a nice little extra.
Wow, awesome.
Piece. Yeah.
Cool. And then I guess the last question that I usually get the most is because people that are usually coming to get this degree are actually already graduated and they want to come back and and do this again. So how much of the program is available to do online? And you already answered that a little bit. And then when they finish the program, are they able to walk right into the job, or is there a second step after actually completing the degree?
So are you referring to the dietetics piece or the,
I'm sorry, yes, to the master's in dietetics.
okay, yeah. So for that one, yeah. So all they have to do is once they've graduated, they have eligibility to sit for their credentialing exam. They can set up their appointment and sit for that exam. Our students finish in December, so usually they take the exam around January or February. But we have had a lot of them start jobs even before that. So right now, our class is graduating next month. I think we've had 2 job offers so far. So they'll be
Awesome.
starting those jobs right away after the first of the year.
That's cool.
Yeah, it's exciting.
Great. Well, that is all I have. I'll check with you, Joyce. Did you have any other last questions for us today?
I did. Normally, how long is the length of the exam?
The registered dietitian exam, I think you get 2.5 hours to take it overall. I think it's a 3-hour appointment, and like the first half hour is, learning how to use the interface. So I think it's about 2.5 hours that you get to finish it.
Okay, thank you.
Sure.
Awesome. So the last piece, I'll talk a little bit about admissions and just kind of how quick that process is. So with Fontbonne, and Joyce, you've already attended, so you know a little bit about Fontbonne, but our application is free. So when you go to fontbonne.edu, in the top right corner, there's an Apply Now button that you guys can hit for the people that are watching this a little bit later on. And you can just go ahead and select what degree you're interested in and submit that program. And then once we get that, we'll just ask for you to go ahead and submit transcripts from your prior undergraduate degrees. And then once we get that, we'll also have you upload a personal statement. So this is just a statement. And I don't know, did you have a prompt? I don't know if your program had a specific prompt for those students or.
We do, but it's on the internal application. So when they apply to become part of the CP, which is
Okay, cool. So those instructions will be in the application. So as long as you are following the application, you'll be good to go there. So it's going to ask you to put in your references. And so just make sure that you have references that you can count on to submit great letters for you. And then from there, I will make sure that we wrap everything up, and then we pass your application on to Dr. French, and she, along with, I think you have some other members that kind of help you with that. And then they get back to us as soon as they can, and then we give you a decision. And then it's up to you if you want to choose to attend. So that is all I have. Thank you guys for attending. Thank you, Joyce, for attending. And I will send you that email, Joyce, here shortly after this ends. So thank you guys for attending. If you need to reach Fontbonne Admissions, you can reach me at wchatmon@fontbonne.edu. So that's wchapman@fontbonne.edu. And then Dr. French, how can they reach you?
My email is dfrench@fontbonne.edu.
Awesome. Okay. Well, thank you guys. And again, if you have questions, feel free to reach out.